So, to be super clear, we're talking about type 2 diabetes. Ready? Okay, you eat carbohydrates, that's sugar and starches, like cereals and bread. They're the food group that your body uses as fuel. To get that fuel into the body uses a chemical called insulin. Think of it as the key that opens your cells to let energy in. But when you have diabetes, either the locks don't work anymore, or your body isn't making enough of the insulin keys it needs. Energy is locked out and builds up in the bloodstream, and you'll feel tired. It's not until that energy gets into the cells of our organs and muscles that we can use it and feel energized. Meanwhile, that energy, which is basically glucose or sugar, builds up in the blood. Your kidneys are working overtime to get rid of it. Some sugar can leak into your urine, bringing with it lots of fluid, which can make you want to wee loads and accounts for why you might be so thirsty. If you want to know more about this, then there's more information at the end of the film. When we're treating diabetes as doctors, we know that we have to keep your blood sugar or glucose levels as close to normal as possible. That means not too high, that's hyper, or too low, that's hypo, which can happen if you're taking insulin or some tablets. If you can work towards reaching the right weight for you, taking some exercise and eating a good diet, it will really help you get a balance between getting enough fuel from your food and burning up enough glucose energy. That way, your blood sugars stay more stable. I know I sound like the health police, but diabetes increases your risk of heart disease and stroke. To stay healthy, you really need to minimise other risk factors, and that means getting to grips with smoking, high blood pressure and high cholesterol. It might be a mountain to climb, but these three need to be taken firmly in hand. Your GP or diabetes clinic can help. I know it's tough, but you've got to do it. So, to monitor your diabetes, your GP or diabetes team will take a reading of your long-term blood glucose level, your HbA1c, every 6 months or 12 months, which will give them a good idea of how well your treatment plan is working. You might be asked to test your blood sugar levels at home if you're on insulin or certain tablets, especially before jumping in the car. There are a lot of mixed messages about diet and diabetes. The truth is, the recommended diet is exactly the same as the healthy diet for everyone else. You want a diet rich in whole grains, that's whole wheat pasta, brown rice, wholemeal bread, fruit and veg, and go for low fat, low sugar and low salt foods as often as possible. And keep an eye on those carbs. Big portions of potatoes, pasta, cereals and breads will drive up your blood sugar levels. They should only make up a quarter or third of your plate tops. And to make things even more challenging, there's hidden sugar in lots of foods. Low-fat yogurt, ready-made meals, even fruit juices. It can still be hard to control your blood sugars through diet alone. So ask your GP to refer you to a dietitian if you need more advice. See your doctor every 6 to 12 months for a general checkup, and also make sure you have an eye, foot and kidney check every year. I know I haven't mentioned feet before, but you've got to keep an eye on them too. There's a film all about feet, but the bottom line is that if your diabetes isn't controlled, the high sugar levels in your blood can damage the nerves and circulation in your feet. Also remember that having an infection like flu, pregnancy, an upset tummy or just a night on the booze can really affect your diabetes. So get a checkup if you're feeling unwell. Keep a record of what's going on. It'll make it so much easier for your doctors to support you.